Hello again. Welcome back. So I'm just about wrapping up here. Got a couple more little pieces of information to describe, talk about. What I want to talk about in this segment, clinical psychologist, family therapist, you and I, is the role of the splitting pathology in all of this. It is very characteristic, very distinctive. And so I wanted to just point it out to you because you'll see it clearly. Once you look over there and look for the splitting pathology, you're just going to just jump out at you. And let me explain where splitting, it's the polarization of attitudes, all good, all bad, highly characteristic, narcissistic, borderline personality. In fact, I'm not sure I've ever run across splitting in any other case except narcissistic borderline, except early childhood. Okay, early childhood, we know where the splitting comes from. It's out of disorganized attachment. So early childhood mental health and the attachment pathology, they're splitting. Narcissistic borderline splitting, but I'm not sure I've ever seen, the splitting's not a symptom of schizophrenia or bipolar or sexual fetish. We never see splitting in other pathologies. Not ADHD, not oppositional defiance. Splitting's not part of those. So it's pretty much confined to the narcissistic borderline, and if you trace it down, it's going to go into what's called a disorganized attachment. The splitting pathology, let me explain where that comes from out of early childhood, out of this disorganized attachment. So in early childhood, child's trying to form an attachment bond to the parent. And when that parent is both a source of nurture, promoting the attachment bonding motivations, as well as a source of danger that's motivating the child to flee from that parent, that creates a conflict in the child's motivational system. They are motivated to bond to the nurturing parent who is simultaneously a source of threat and is motivating them to flee. And even the flee motivation is motivating them to flee to the protective parent who is the source of danger. And so within the attachment system, when the child is confronted with a parent who is both a source of nurture and simultaneously a source of threat, that rips the child's motivational system apart. They now have two immensely strong motivational directives, one to bond and one to flee. And it just can't figure it out. The attachment system can't figure out what to do in that situation. Now, in attachment pathology, we have two primary categories, secure attachment and insecure attachment. Insecure attachment has three different categories to it. Insecure preoccupied or insecure ambivalent, insecure avoidant, I'm okay, I can take care of myself, and insecure disorganized. And it's this third category that we're talking about. It's a really severe, problematic form of attachment. The other two categories, the anxious ambivalent and the avoidant, they at least have strategies for bonding to the parent. The ambivalent one creates a lot of protest, creates a lot of noise and activity and everything to get the parent to bond to the child or to come over to the child, pay attention to me. And so their strategy for bonding is to create a lot of calls, a lot for involvement, a lot of protest behavior, anxious ambivalent. The anxious avoidant is, they are low demand. They say, no, I'm okay. Everything's fine. I don't need anything. I'm good. I'm all okay. And so their strategy for forming an attachment bond is to be low demand. The reason on the anxious ambivalent children, the reason they're high protest is because they have a variable parent who may be there, may not be there. And so the child doesn't know whether that parent's kind of involved in watching them safe, taking care of them safe, are they bonded? And so by creating a lot of protest, they get this parent who may not be involved to be involved. The anxious avoidant one is in response to an overstressed parent, a parent who's maybe depressed or maybe overstressed. So if the child presents demands, the parent withdraws further. So the best way for the child to bond to the parent is to be low demand. Don't make any demands. Everything's okay. Take care of everything. And then the parent will stay close. If I make demands, the parent goes away. So that's the second type. Both of those, though, are strategies for how to bond to the parent. So they are organized strategies. They are reflecting insecure attachment to the parent. The third category, the disorganized category, that's when the child attachment system has no organized strategy for forming an attachment bond. That's why it's called disorganized. No organized strategy. They don't know how to do it. The child cannot figure out how to form an attachment bond to that parent in any way, shape, manner, or forms. It's disorganized. And if you go back to that parent who is simultaneously a source of threat and a source of nurture, we can see why that disorganization occurs. If the child tries to bond to the parent, they're a source of threat and danger, and I need to flee. If the child flees, they're not bonding to the nurturing parent, so what do? What do they do with these two conflicting and incompatible motivations that are strongly motivating them to bond and to flee simultaneously? Disorganized attachment. I have no idea how to figure this out. The disorganized attachment over the course of time stabilizes around late adolescence, early adulthood. The attachment system and these internal working models of attachment and the schemas of attachment stabilize and coalesce into what we call personality structures. And so that's where we see the characteristic personality pathology of a narcissist or borderline or whatever. But we got at a lower level, we have these attachment networks. So the narcissistic borderline personality is coming off of a disorganized attachment, stabilized in later adolescence, early adulthood. The splitting pathology comes from that motivational conflict. Let me explain something a little bit about the neurological networks of the brain. We have an attachment bonding motivation, we have an avoidance motivation. So we got these two motivational networks. And they have a little bit of connection to each other, a little bit of crosstalk, these neurological networks. So that if we like somebody, if the attachment bonding motivation system is going warm, there's a general halo effect, it's called, where we tend to see positive things about the person. If we dislike the person, we tend to see negative things about the person. That's a negative halo. Okay, so there's a little bit of cross-inhibition between the two. If I don't like you, I inhibit my bonding motivations towards you a little bit, and I don't like you so much. If I like you, I inhibit my dislike of you a little bit, and I kind of tend to see this glow, this halo. And now for most of us, the normal range people, we can have both of these systems on at the same time. We can have the bonding motivation system on at the same time and the avoidance motivation system on. And so we get these complex blends of people. I like you mostly. There's some things you do I annoying. I mostly dislike you, but you know what? You're kind of okay. You're a nice enough person. I'm just not particularly fond of you. So we can have both systems on at the same time and create complex blends of our perception of relationships. In the early childhood disorganized attachment, though, in that child trying to bond to a frightening and dangerous parent, if the child bonds to the parent, they are totally exposed to the dangerous side of the parent. If they avoid the parent, they lose all of the nurturance of that parent. So they have this bonding and motivation that is in conflict and is intense. How does the brain solve that? In order to acquire one motivation in that situation so that the child has clarity about what they're supposed to do, the attachment system has clarity as to whether to bond or run. Whatever motivating system is on entirely cross-inhibits the other one. The other one is absolutely turned off. And so those small-scale inhibitory networks that the rest of us have, the halo effect, I kind of like you, those little brain networks in this pathology get buffed out. They get really, really strong. So that if the attachment bonding motivation system is on, the avoidance motivating system is entirely turned off. And if the avoidance system is on, then the attachment bonding motivation is entirely turned off. So only one or the other can be on at any one time. There's your splitting. Only one or the other system can be on, and the other system is being neurologically inhibited, completely shut down. Neurologically, at a neurological level, is being entirely inhibited by the activation of the other system. So either I think you're wonderful and idealize you, or you're, the devil and you're evil incarnate. Boom, boom, back and forth. So, when we add the splitting pathology of a narcissistic borderline parent, this disorganized attachment, you add the splitting pathology in the neurological networks of that person's brain to the cross-generational coalition. When the divorce took place, as long as I'm married, as long as that person is married, that spouse is in the attachment bonding system. That's my spouse. That is my attachment figure. They are, now I may have trouble with them, I may argue with them, I may not, but they are still my spouse. They are still my attachment figure, even though I'm having conflict with them. The moment there's a divorce, that person becomes the other. That person becomes the bad one. And so now, so during the marriage, the attachment system, bonding system is primarily on. With the divorce, it shifts. Now the avoidance system is primarily on, the bonding system entirely turned off. So now the avoidance system is entirely on, demonizing, you're horrible, you're awful, you're evil, you're abusive, you're this, you're that, well, totally turned on. When we add that pathology to the cross-generational coalition, it transmutes, it transforms the cross-generational coalition into a particularly malignant and virulent form that I cannot, or the narcissistic borderline personality parent cannot simultaneously have both brain systems on at the same time. So the moment that spouse becomes part of the avoidance system, the bonding system is entirely turned off, so that that parent can no longer perceptually recognize that the child still has a bond to that parent. Because the child's bond to the targeted rejected parent would require that the attachment bonding system be active, so that I could see the child has a bonding motivation to that parent. But that system is entirely shut down. That's not working. That whole brain area of attachment bonding is dark. And instead, it's all the avoidance stuff that's just glowing and active and around that other spouse. And the splitting pathology cannot maintain ambivalence. It's one or the other. It can't handle ambivalence. Wonderful article by Juni. Go to my reference list. Get the Juni article, Juni, on splitting pathology in the service of ambivalence. That the splitting pathology cannot manage ambivalence. So what happens is, the moment that spouse becomes an ex-spouse, within the consistency of the splitting pathology in the neurological networks, that ex-spouse must also become an ex-parent. In order to maintain the consistency required of the splitting pathology embedded in the neurological networks of the narcissistic borderline pathology, the ex-husband must become an ex-father. The ex-wife must become an ex-mother. It must be consistent. The neurological networks, the polarization of the neurological networks of the narcissistic borderline brain will not allow the ex-husband to be an affectionate father. That requires the two systems on at the same time. You're an ex-husband, but you're still a bonded, affectionate father. Two systems have to be on simultaneously. That's impossible. You are an ex-husband, you are an ex-father. You are an ex-mother or ex-wife, you are an ex-mother. Consistency of one or the other, not both. What you will see Clinical psychologist, family therapist. The feature you will see for this addition of splitting pathology to the cross-generational coalition is an obsessive fixation on the part of the allied narcissistic borderline parent to terminate the other parent involvement with the child. That other parent must become an ex-parent. That other spouse, the ex-wife, the ex-husband, must become an ex-mother, an ex-father. So I have a standardized assessment protocol. I'm recommending 6 sessions. You go through each one of the sessions and you're gathering specific information from each one of the sessions. Those last 2 sessions, that last session with the narcissistic borderline parent, this is particularly what I'm looking for in that session 5 or 6 with that narcissistic borderline parent. I'm going to give them feedback about the family situation, and what I'm looking for is that obsessive quality that the ex-spouse must become an ex-father or an ex-mother. And as I challenge that, or as I move to other possibilities, you'll see the obsessive quality of that. You'll see the rigid fixation quality to that just lock in. They are unable to conceptualize any other model for the family that does not involve the ex-spouse being an ex-mother or an ex-father. And so, now if you're not probing for it, if you're not looking for it, it may sit beneath the surface and you don't necessarily see it. But the moment you start to look for that consistency of the splitting, it'll jump right out at you. And it's the obsessive quality to that, because this is a neurologically imposed imperative. Their brains neurologically cannot incorporate ambiguity. The ex-husband must become an ex-father. The ex-wife must become an ex-mother. Very characteristic symptom feature.